Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through July 1st, 2021. Today, I'm going to go back and ask a question that I've normally asked every week, and that is, how is the pandemic progressing globally in the United States and in our region? And then I'm going to address a question that has come in several times, which is, what should I know about the Delta variant? In terms of the pandemic globally, we're getting very close to 4 million deaths worldwide, a 1.3% increase in the past week, which is the lowest percent increase that we've had. That's good news, but a couple of things to be careful of. Even at 1.3, that means there's been 100,000 deaths worldwide in the past 2 weeks and about 5 deaths every minute in the past week alone. So while the pandemic may be slowing down, it is still burning very, very hot. And if you look at the daily number of deaths, you can see that there was a spike back in March and April, and a pretty significant number of deaths every day for most of the summer, and then 2 high spikes in the winter and early spring. And now it's been coming down, but is still above the daily number of deaths at any time between March and mid-October. So again, the pandemic has not stopped. It is still growing worldwide, perhaps slower than it was. There are now 23 countries that have had over 1,500 deaths per million. The US is there at number 15. What I'm watching with some concern is what appears to be a resurgence of growth in the Americas. You'll recall, over the course of the pandemic, of course, it first appeared in China. Then the first spike was clearly in Europe, a significant number of deaths there. And then over the summer, largely in the Americas. Then the first of the 2 winter spikes was both the Americas and Europe. And then we've been watching with some concern the resurgence in South Asia, especially in India, but perhaps not paying quite as much attention as we should to the growth in the Americas. So again, the pandemic continues to grow around the world. There are many, many countries where well less than 10% of the people have been vaccinated. So the pandemic will continue to spread in those countries. In the United States, we've had 620,000 deaths, 0.3% week-to-week increase. That's the lowest that we've had at any time. The last couple of weeks have been about 0.4%, so 0.3 is not significantly lower, but it's certainly better. But even with that, there's over 1,500 deaths last week in the United States. That's 225 deaths a day. And, we throw numbers around so much, it's hard sometimes to get your mind around what is 225 deaths in a day. It's a significant number. That's 9 deaths per hour. And again, we saw the spike in last spring. We saw a single winter spike, not the double spike that was seen globally. And we've seen a pretty significant decline since then, but we're still not down to 0. So we'll keep our eye on that. I put this slide in last week, but I want to put it in again because it's frustrating when people tend to minimize the importance of this pandemic. And especially now, if it is slowing down, there'll be people who say, well, see, we were right all along. It wasn't that serious. So how do we understand 620,000 deaths? Well, that was more than all the soldiers killed in the United States Civil War, the bloodiest war in our history. It's more than the soldiers killed in World War I, II, Korea, and Vietnam combined. It's more than the number of cancer deaths we have every year. It's more than the number of deaths from injury, stroke, diabetes, and Alzheimer's disease that we have every year. It's greater than the population of Louisville, Milwaukee, Baltimore, Albuquerque, and considerably greater than the population of the Tri-Cities. So this was, and continues to be a serious global pandemic of really significant importance. In terms of our region, over 2,100 deaths, 17 deaths in the past 2 weeks. We've been following the number of hospitalizations at ballot, and this is the lowest number that we've had, but still 27 people are in the hospital. So certainly worth paying attention to. In terms of the Delta variant, this is of great concern to folks because this could represent a turning point in the pandemic. We'll wait and see. What we know about the Delta variant, the name Delta was just because it was the next one for WHO. It's not from the Delta region or anything to do with the airlines or anything else. It was first detected in India and now spreading rapidly around the world, occurring in over 85 countries worldwide. It accounts for over 90% of the cases in the United Kingdom and about a quarter of the cases in the US, and has been identified in all 50 states. So let's talk very, very briefly, very simply about viruses, right? A virus comes into the body, it grows, expands, and it mutates, it changes. And the virus that leaves the body may be slightly different than the one that came in. Well, that doesn't really matter unless those variations, those variants, have some clinical meaning. And I tend to think that we need to pay attention to three types of changes. Transmissibility, how easy is this virus to spread from one person to another? Lethality, how serious, what kind of disease does this virus cause? And susceptibility, and that is a sense of, okay, if you have immunity already from a vaccine or from another disease, from a natural disease, does this new variant escape that immunity? And in each case, it can be less, same, or more. So what do we know about the Delta variant? Very clearly, it is more transmissible. They're saying it's at least 50% more transmissible than the Alpha variant, which was probably 50% more transmissible than the original virus. That's worrisome because even if lethality doesn't change, even if susceptibility doesn't change, it means we're going to see more people die, because if the virus spreads more easily, people that might not have been infected otherwise will get infected. So clearly this Delta variant is more transmissible. And, the fact that it's now representing a quarter of the cases in the US, 90% of the cases in England tells you that, right? It has spread more rapidly than the other variants, a little bit like crabgrass in your garden, right? If you start to see crabgrass going, it's because it's spreading more easily. In terms of lethality, it's a little bit hard to say. Initially, they looked like there may have been some different symptoms being reported in England, but part of it was because it was a different population. As more older adults were vaccinated, we're seeing the disease more in younger folks. Probably what we're really seeing is a variant that is slightly more lethal, that we don't know for sure. And the reason I say that is it's really maybe too early to tell. This is the case. These are daily cases in England. And you see they had their spike. But now you see in the last month or so, this growth in the number of cases. But what we haven't seen yet is a growth in the number of deaths. Now, we do know that deaths tend to follow cases by 2 to 3 to 4 weeks. So it may be that we just haven't seen them yet, or it may be that it's not as lethal as we thought. But really, at this point, we don't know. In terms of susceptibility, it appears that 2 doses of the mRNA vaccines are highly effective at preventing the disease with Delta variant. Initial reports suggested that the single-dose vaccine might be less effective, but a report came out earlier this week to suggest it's not. It does appear that a single dose of the mRNA vaccine may be less effective against the Delta variant than against other variants. So let's say that perhaps this is slightly less susceptible. A lot to learn about the Delta variant, but one thing is certain, and that is if you are not vaccinated, and if you live in a region like ours where there are lower rates of vaccination, this poses a significant risk to you as an individual and to us as a region. Important to remember, as long as SARS-CoV-2 spreads around the world, especially in unvaccinated populations, it will inevitably continue to mutate. Future mutations will almost certainly vary in transmissibility, lethality, and susceptibility. And they may pose a greater risk to everyone, including those who've been vaccinated. Therefore, it behooves us to not only get vaccinated ourselves, but to be sure that we can start getting people vaccinated everywhere in the world. Great deal more information about COVID-19 on the College of Public Health website. Thanks. If you don't know anyone who would like to be added to our mailing list, please let Jan Stork know. Thanks as always to Dara Young for editing, producing, and posting this video. If you have any questions, please contact me. I do my very best to answer your questions either directly by email or by incorporation into future updates like this. I look forward to seeing you in a week. Until then, please be well. Thank you.